The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.
Talk about not seeing eye to eye. Optometrists and the province are in a big dispute. Tonight we'll hear from both sides, plus get some historical context around what OHIP covers and why. Then, is there any common ground to be had with science deniers and conspiracy believers? Author Lee McIntyre tells us what he learned among the flat earthers and the pandemic skeptics. It's Tuesday, September 28th, and that's all ahead on the agenda. Starting September 1st, optometrists in this province began a work action that means seniors and children cannot book appointments to get their eyes checked. With us now for the doctor's perspective in this fight with the provincial government, we're joined in Hamilton, Ontario by Dr. Sheldon Saliba, president of the Ontario Association of Optometrists. Dr. Saliba, it's good to have you with us on TVO tonight. Can we just start by having you tell us, in your view, what led to the job action?
You know, we've been working with the Ford government to try and get them to come to the table and work with us to figure out a sustainable eye care system for patients in this province since the beginning of their mandate, but we've been met with silence. And last year in December of 2020, which was our last communication with them until August of this year, you know, we did everything that we could possibly think of to get the government to pay attention to this issue, and we were met with radio silence for 8 months. And back in March of 2021, when there was no funding announcement for primary care services in the province in the budget, we set a service withdrawal deadline of September 1st, and we're hoping that the government would engage with us to come to some type of solution. And they left everything until the 11th hour. We had some brief interactions with them over 3 days in August, and they would not commit to paying the operating costs for the services that we're providing. And unfortunately, services were withdrawn.
Okay, just confirming there are no talks happening as of this moment. Is that right?
That's correct. We haven't heard officially from the government since August 29th.
All right, shall we, I presume there's two possible explanations for this. One is that they really have it out for you guys and they don't like you. Or the other is, you know, we're in the middle of a global pandemic and they think they got bigger fish to fry. Is it more likely the latter than the former?
Well, listen, vision is our most important sense. And regardless of whether or not we're in a pandemic, I think you have to consider that these are essential healthcare services, and they're services that need to be dealt with and managed. I think what we're seeing here, there's a history of 32 years of Ontario governments not taking action around primary eye care services, and I think that's where the real problem lies.
Let's do some of the math here, because I think people need to have a better understanding that if, for example, they are going to see you, and the Ontario Health Insurance Plan reimburses you for part of the cost of the service that you are providing. Let's do the math. What does it cost, and what does OHIP actually reimburse you for?
So we have multiple data points that indicate that the cost to provide a comprehensive eye exam in the province on average is around $80, and OHIP on average is paying $45. That 45 number has only increased $5 since 1989, and at that time we were being paid $39.15. So if you take that $39.15 and inflate it over 3 decades, you're arriving at a number that's close to $80. And you know, we've done studies. We look at other jurisdictions. There are 4 other provinces in Canada that provide publicly funded eye care services. And when you compare apples to apples on what is being provided, the next lowest reimbursed province is Manitoba at 77. Following them is Quebec at 106. And following Quebec is Alberta at 137. So we don't understand why all these other provinces have been able to figure out how to resource these important services, and the Ontario government can't.
So just so I understand, is this to say that every time you deal with a patient who needs to use the health insurance plan to see you, you're losing money?
Yes, we're paying to see those patients. That's correct.
How does that make sense?
It doesn't. That's why such a drastic action is being taken, because we want to, we have to break this logjam with the government. They need to understand from the public the importance of these services to people, and they need to resource them correctly. You know, optometrists in this province are offering to still work for free. So the optometrist isn't going to receive compensation, but if they're reimbursed at the $80 level, that's going to cover their costs like rent, staff salaries, insurances, equipment rental, utilities. That is what it costs to provide a 20-minute to half-hour service to patients in this province.
Let's also understand the kinds of patients that you see. Now, the kind of dispute you're having with the province right now would not cover, for example, somebody whose eye care is covered by a workplace private insurance situation, right? This is only for the people who rely on OHIP to get these services. Is that fair to say?
Yeah, but that's a large portion of the patients we see, on average 70% in our practices. So you're talking children, seniors, and adults with medical conditions. And that's a very large portion of the population.
Okay. The province says that it has offered a $39 million lump sum payment and an 8% increase in the amount paid, and to align future increases with what other physicians get. They say that's what they've put on the table. What's your reaction to that?
You know, linking us to physicians in this province isn't fair, because physicians haven't been treated the way we have over the last 32 years. So it's not really an apples to apples comparison. If they want to link us to future physician increases, I think they have to go back 32 years, not 10, and give us the same increases and decreases that physicians have experienced over that period of time. And then we're going to come out at something that's fair. And that number is, again, going to land at around $80. You know, they offer a $39 million lump sum payment that is retroactive for the last decade. That we performed 34 million services in the last decade. So that number represents about $1 per service that we provided. The 8.48% increase on our existing fee codes would represent about a $4 increase. So if you lump those two together, you're going to see on average the reimbursement for an eye exam move from $45 to $50. And that's still going to see the optometrist paying $30 to subsidize those costs to see patients. So that is not a sustainable system that we're creating here. The other thing I'd like to say on that point, if I can, you know, the government says that they are trying to lay a foundation to work reasonably with optometrists in the province. And I just want to point out that in August, we had a 2-hour meeting with them on August 5th, and then we had 2 days of mediation. Then they released the $39 million and 8.48% offer publicly. That is an act of bad faith bargaining. That was what they offered us inside of a confidential mediation process. And 2 hours after the mediation ended, they put that number out publicly. The other thing that I'd like to point out is the $39 million that they're offering is a bargaining tactic, and it's a waste of taxpayers' money. When under typical compensation negotiations between service providers and the government, it's unlawful for them to be able to offer an offer like this publicly during this type of compensation negotiation. So none of the actions that they're taking are providing any trust to us that they are actually interested in ever funding what it costs to provide these services.
No, I hear you, but the tricky part of this, of course, is that this is not just a negotiation at a bargaining table, it's also a public relations fight. And at the moment, you're telling people, seniors, younger people, for example, that because of your fight with the province of Ontario, they're going to have to go seek their eye care in emergency departments in hospitals where A, it's infinitely more expensive, and B, there's probably a wait list up the yin-yang because of all the backlog for procedures that have been delayed by COVID. So how is that consistent with the best care of your patients, which I know you folks like to give?
You know, you have to understand that in a system like this, we aren't able to deliver the best care that people in Ontario deserve. And what we're doing is fighting for our patients' rights to be able to have access to these high quality services. This is not an ideal situation. I'm shocked that the government would be so cavalier and leave things to the last minute and then behave in a way that does not instill trust in us as service providers in wanting to work with us reasonably to ensure that primary care services in this province are no longer funded the lowest in Canada. So I feel bad, and so do all of my colleagues, that we're not able to take care of our patients right now because we're doctors. We want to be able to help people make sure seniors can lead independent lives, treat eye diseases, all of those types of things. But at this point in time, because of the actions that the government are taking, we're not able to do that. And so people that have been scheduled for routine care are going to experience delays. We're going to make every effort when patients call us if they are having an emergency. We're going to make sure that they're taken care of properly. But really, the government needs to come back to the table and make a commitment to ensure that primary eye care services in Ontario are no longer funded at the lowest rates in Canada.
No, I take your point on that, but let's finish up on this then, Dr. Sheldon. You guys are well paid. You should be well paid. You spend a lot of time going to school to develop the expertise to perform the services that we need you to perform. But again, going back to this being a public relations fight, if the government is able to portray you as six-figure income people who are putting your own financial needs ahead of those of your patients, how exactly do you come out of this with any glory?
Well, I just think that that's simply not true. We aren't able, practices are stressed out and we're unable to provide the same quality of care that patients receive in other parts of the country. So I don't think that the government is successfully portraying it that way. Our patients are supportive. They value the services that we provide. They value the time that we take with them. We help them navigate very stressful situations if anything ever happens to their vision, and they appreciate that. The patients also understand that a $5 increase over 32 years is ridiculous, and they understand that the government is playing games. So, we want to work with the government to fix this problem, and we want to be able to reinstate our services and be able to start taking care of patients again.
Understood. Dr. Sheldon Salemate, President of the Ontario Association of Optometrists. We appreciate you sharing your views with us on TVO tonight. Thank you.
Thank you very much. Take care.
And now for the other side in this disagreement, we welcome in Midtown of the provincial capital, Robin Martin. She is the parliamentary assistant to the Minister of Health and the PC member for Eglinton Lawrence. And Robin, it's good to have you back on our airwaves. How are you doing today?
Very good, Steve. Thank you. How are you?
Glad to hear it. Not too bad at all. Let's just hit this right off the top. Do you think, in your judgment, the province of Ontario has made a fair offer to the optometrists?
Yes. I mean, as you pointed out, we've made a $39 million offer, which is a retroactive payment. And what we're trying to do is show good faith to the optometrists that it's a kind of a catch-up fee for 10 years, going back 10 years since they've had an agreement. Which ended in 2011. And it gives them $39 million. They're going to see it on October 5th in their remittance advice, and it will flow on October 15th. And that's regardless of whether the OAO comes back to the mediation table or anything else, or whether we get an agreement. However, it is a sign of good faith, and we're hoping that the optometrists will respond in kind, in good faith, by continuing to provide what Dr. Salemate, in the interview you've just done, said are essential medical services for seniors and children, and also, show us their costs so that we can come to an agreement about what is an appropriate fee.
I talked math with him, so let me talk math with you. How did you arrive at the $39 million figure?
Well, it's basically going back and looking at the increases that physicians have had over the 10 years and doing the equivalent for optometrists. And so it's a catch-up kind of a fee. We've also offered to increase the OHIP fee immediately that they're being paid by 8.48%, which, given the constrained fiscal environment in which we're operating right now during a pandemic, is generous, I think, and is a good starting point for discussions. We're not saying that's the end of it, but we need to see evidence to go over in detail what their costs are. Remember that optometrists in Ontario provide OHIP insured and patient pay services like selling contact lenses and glasses and non-publicly insured services. And so their costs are kind of complex to calculate, right? They would be different depending on patient mix, the types of patients they get, their rent, how much technology they use. Any number of things would factor into, what their costs are and what their revenues are. And, we're having an increasingly digital healthcare system. It's really burgeoning with digital technologies. And that's also impacting how optometric services and other services, other health services are provided. So we need to go over all of this in great detail with them.
No, I appreciate all that, but let's, again, going back to the math here, just see if you agree with his basic premise, which is that it costs them $80 to provide the service, and OHIP basically reimburses $45 of that. In other words, they're losing money every time they see those patients. Do you acknowledge that?
I hear you, Steve, but honestly, we don't know what it costs. That's what they've said, it costs. But we don't know what it costs, because that's why we have to get back to the table and do that work and look at all those services that they're providing and all of those things I just went through. We don't know what it costs. We can't just take their word for it. That wouldn't be fiscally responsible as stewards of taxpayer dollars. And frankly, they're being a bit disingenuous about the way they represent the coverage of eye care or vision care across the country. I mean, Manitoba may have a higher fee, but it pays it only once every other year, not covering every year as we do in Ontario. So there's a lot of other things to consider. A lot of provinces don't insure or cover optometric services at all. 6 of them don't provide seniors eye exams. 5 of them don't provide annual exams that are insured for children. And I think Ontario is the only province where you don't have to pay for an insured service, publicly insured service, out of your own pocket. So there's a lot of differences to consider. And we're not getting the full picture in the talking points from the OAO. And I think it's important that we understand all of those things so we can come to an agreement and, make eye care sustainable across Ontario, as we want to do. We want to continue to fund these services. We know that they're important to people. I think Dr. Salaba himself said that these are essential services. So not providing them and sending people to emergency rooms and hospitals in the middle of a pandemic is very disconcerting.
No, I know. I appreciate your point, but he would also say that the use of the term talking point for the money involved here, which they say is a third-party accounting firm calculated number. This isn't their quote-unquote talking point. It is something that a third independent party came up with, that it costs anywhere from $75 to $80 for them to provide that service, and yet OHIP only reimburses, not even about half of it. That in their view, that's not fair. I still think we need to get back to the issue of how you would convince them that they're in a fair situation when they're losing money every time they see a patient.
But Steve, I'm not trying to convince them that they're in a fair situation and that there is nothing else to be done here. I'm trying to convince them to come back to the mediator's table, to accept the mediator's condition, as the ministry and the government have done, and to be there to look at those costs in detail. We've promised to set up a joint working group to do that. And all we want to do is look at their costs. They say we're not covering their costs. Let's see what those costs are. If they want us to cover their costs, surely they should have no problem in sitting down with us and going through that. The study that they commissioned is a representative, well, it may not be a representative example. It is 74 optometrists out of 2,500. Are all their costs the same? Probably not. I'm sure, like I said, that many optometrist costs differ given the nature of their practices. And, that there's a whole lot of things that go into that. So I think that's what we need to get together to talk about. I just want them to come back, to talk with the mediator, a third-party independent mediator who's well regarded, and to go through this with us instead of, having a fight in the media about, essential medical services. We want those services to be delivered on an ongoing basis to the people who need them.
All right, maybe you could speak to those people right now then, because if they cannot get appointments with their optometrists in order to get the service that they have relied on in the past, and if their optometrists are now telling them, go to your emergency department at your local hospital and let them handle it, what advice would you have for those people on how to handle that situation when almost certainly they'll be waiting 6, 12, who knows how many months for that service because of the backlog and everything else right now?
Yeah, I mean, it is a very unfortunate situation. And so my advice would certainly be to look for another optometrist who is providing the service, because some are providing the services on an ongoing basis, or go to the College of Optometrists. The College of Optometrists regulates optometrists, and they have professional obligations to provide these services. And the college has said that they will help patients to ensure that these professional obligations are fulfilled and that they're getting the services they need. So that would be my advice. And frankly, I'm sorry for the inconvenience that people are going through. But honestly, I don't understand how anyone can expect to get a deal without coming to the table and talking about the very issue that they think is the issue, which is overhead costs and how they're being compensated for those. They can't just expect us to accept on faith what they have said is the number for something that is so complicated. And also, we don't have all the evidence. We don't have all the information. We do this with other health professionals all the time. We come to negotiated deals, and other health professionals, frankly, the expectation is they'll continue to provide these services, and that is the usual practice while we're negotiating.
All right, just finally then, would you expect them to be satisfied being the 10th best paid optometrist in the whole country? Because that's what they say they are right now.
Yeah, again, I think that we don't have the full picture of even how they're paid. Because they get paid for other OHIP insured services, not just the eye exam, which is the one they're referring to, and we don't have the full picture of what their costs are, and what their revenues are generally. So I think our optometrists are great service providers. We want to have a deal with them. We respect their abilities and services, but honestly, healthcare in Ontario is changing. And we need to sit down with them and understand what their current costs of services are and work through that together so that we can come to some kind of a deal. And that's all we're trying to do. And if they don't come back to the table, I don't know how that happens, because I think, if you want to negotiate something, you've got to be there to negotiate it.
That's Robin Martin. She's the Parliamentary Assistant to the Minister of Health for the Province of Ontario and the PC member for Eglinton Lawrence. Robin Martin, we're grateful to you for coming on to TVO tonight and sharing the government's position on this. Thanks.
Thank you, Steve.
Delisting OHIP services, well, it's not exactly popular. People understandably don't like paying out of their own pocket for things that used to be covered by the province's health insurance plan. With us now for some historical perspective on disputes, such as the current one with the optometrists, we're joined from Guelph, Ontario by Carly Weeks. She's a health reporter for the Globe and Mail, and we're delighted to welcome her back to our airwaves. Carly, how are you managing these days?
Can't complain. We have a nice roof over our heads. Everyone's doing well and we're healthy.
Glad to hear that. Now, you just listened to the two different interviews that we just did with the head of the Optometrists Association as well as the junior health minister. Are you able to come to a conclusion based on your coverage of this issue and what you just heard from the two of them as to which side is closer to the angels on this issue?
Yeah, well, asking me to be mediator is obviously putting me in a tough position. But having been a health reporter for a number of years, I can say that I think that there's some valid points on either side. What we are seeing here is a major impasse after sort of years of underfunding. I think we can agree that optometrists have been sort of underfunded when it comes to the OHIP insured services. Disputing all of the numbers and everything, I'll leave that to the bargaining table. But on the government side, costs are rising, things are sort of escalating, and we can all see with the COVID crisis and everything that's been going on, the current levels of spending aren't sustainable. I'm not sure what the solution is here. I don't think that shutting a lot of people out of getting appointments for an extended period of time is going to be benefiting anyone in the long term. I'm sure we can all agree on that. But I think really what the issue is here is that there are some fundamental problems with the way we've been funding and approaching things like vision care for many years. And it's just sort of one example of how our universal system really isn't that, and that vision care is kind of left to the individual to sort of figure out on their own, which means that a lot of low-income people often get shut out.
I'm going to come back to that in a second, but if there's one thing both sides in this dispute agree on, it's that it's not all the fault of the current government, that this is a circumstance that basically developed over nearly 3 decades. Do you have any idea as to why successive governments over the years have sort of allowed this to fester to the point now where a withdrawal of services has been contemplated?
Yeah, obviously, and no one wanted to see this. This is a rather dire situation for those who kind of haven't been paying attention. This is really serious. So if you do look back historically, things have been sort of been withered away when it comes to things like vision care in the province of Ontario for a number of years. Obviously, the most significant date in the last couple of decades was in 2004, when vision services for most Ontarians were delisted. So until that point, most people could go and get an eye exam covered, sort of a once a year kind of thing. And after that point, it was a very significant moment when things were delisted. And from then on, that's how we entered into this current situation where the province does pay for, they do cover things for people who are young, people who are old, and people with certain eye conditions. But basically, the 2004 mark kind of signified this moment when vision care really kind of, from the province's perspective, I guess, really ended for most Ontarians. And then it was left up to private insurance and people to pay out of pocket. This kind of thing has been going on across Canada, and it has been going on for a long, long time. Kind of the elimination of services, the delisting of services, it's been going on for a number of years, many, many years, and it extends to other things other than vision care, dental care and things like that. They were seen as sort of an individual's responsibility, I think, for many decades, that it's up to the individual to sort of figure out how to brush their teeth and take care of their eyes. Thinking has changed, and I think for the better in a lot of ways. And there's now a greater recognition and a greater push toward recognizing that things like vision care, things like dental care are really part of a person's whole health. And so a person who's maybe a low income and can't pay out of pocket, their kid doesn't necessarily have to go to school without being able to properly see, or the elderly person who doesn't qualify yet for the over 65 coverage. Are they getting those exams to make sure that conditions like glaucoma are being caught in time? I guess my overall point is that for the longest time, we've allowed these kinds of health conditions to be pushed onto the back burner by saying, well, these aren't really the government's responsibility. It's up to the individual person. And I think that evidence is showing us that's not really the case. These are part of health and they need to be treated as such. What the government does next and what our optometrists do next, I think that's the difficult question we face now.
Sure. Well, I well remember back in 2004, it was the Dalton McGuinty government that delisted these services, and they did so simply as a cash-saving measure. They saved hundreds of millions of dollars by delisting these services and declining further coverage on them. Do you think, though, I mean, here we are 17 years later, and we've seen the consequences of that decision. Do you think inside healthcare attitudes on this have changed, and that there is now perhaps a greater push to include, as part of OHIP insured services, vision and dental?
Definitely. There has definitely been a change. And I've even seen it through the course of my career. I started out, I remember, as an intern covering the 2004 announcement and what a significant day that was. And really since then, what the attitude has changed from, well, if you need glasses, then that's too bad, you'll have to pay for that, or, if you don't have insurance, to really an attitude now where there are, federal parties like the NDP just campaigned on getting universal dental coverage included for all Canadians. There's been this greater recognition and a greater push toward recognizing that people who are low income shouldn't be punished because they can't afford to pay for some of these services. And while it is true that a lot of these services get paid, they're covered by provinces if you're in sort of the lowest income bracket, there's a number of people who are sort of what we call, people who are referred to often as the working poor. So they have a job, but they still don't qualify for these benefits or programs. And so themselves and their children go without. When we think about things like dental and vision care, they're not just about being able to see or having clean teeth. This is about, long-term health problems that can impact people. So if you're not having regular eye exams and, you could be developing a serious eye disease that goes unrecognized, and that does eventually cause blindness. So things like glaucoma, for instance, that's a very common eye condition that you do need to have monitored and tracked, and if you go for regular appointments, your eye doctor will recognize it and say, okay, we need to start you on a course of treatment before it gets any worse. Same thing with dental care. We now know, and there's been so much more evidence that's come out in the last decade, linking poor oral health to things like heart disease and other forms of very serious chronic health conditions. So the immediate savings for the government are, of course, lucrative, and the government is cash strapped and we don't have all the money in the world to pay for everything. But on the flip side, the long-term costs of ignoring these things and letting these problems fester, and then people ending up in the hospital or ending up with things like, blindness. Not only is it a massive cost in terms of to the healthcare system, and there are estimates that it's, in terms of billions of dollars in healthcare costs, which I think can be disputed or talked about. The cost to the individual is also massive. So there are a number of people who are experiencing vision loss and blindness because they simply were not able to afford those yearly exams and checkups and monitoring. And plenty of research has shown that in the years since the delisting happened, the number of eye diseases that have been diagnosed has dropped. That doesn't mean people stopped having eye diseases. It means they're just not being diagnosed as frequently anymore.
Well, if admittedly, this is a bit of an unfair question to put to you because you probably don't have the numbers at your fingertips, but you probably can make a comment about the fact that if optometrists are not seeing patients in their office and they're telling them to go get checked out in the emergency department, which is, to be sure, a more expensive setting, and presumably it takes longer to get in to see somebody there. Therefore, when you present, your circumstances are going to be worse than they might otherwise have been had you got faster treatment. I mean, surely that all costs a healthcare system at the end of the day a lot more. So how are we ahead?
Definitely. And I think that the optometrists here realize that, if you're going to send a patient to an emergency room or to a family doctor, most likely in a lot of cases, they will end up being turned away because, family doctors aren't set up to give proper eye exams or other kinds of treatments for those kinds of conditions that they might be referred to right now. So I think the real loss right now and the real dire situation are the ones facing those families that are currently being turned away, and the ones who are being told, even though you don't have OHIP, you don't have the option to pay out of pocket right now because of this impasse with the government. So there are people who are really suffering as a result of this right now. Hopefully this is a temporary situation, but it can't go on much longer because, and then I think that's why, obviously the optometrists realize there is a lot of pressure on the government to make a move here and hopefully to resolve this in a way that everyone can agree on, because really it's the most vulnerable people who are suffering right now as a result of this. And these are the same people that have been suffering throughout the pandemic. People that are referred to as, the working poor, people who are lower income, often people who are racialized. These are the people that need as much help as they can get. And this puts them at an even greater disadvantage.
Carly, in our last 20 seconds, how do you figure this thing ends?
I think that they will go back to the bargaining table. I can't imagine the optometrists or the government will get everything that they want in the end. I think that if I could make one plug, it's for the fact that we need to rethink how we fund these things, and a cost saving up front is not really a cost saving if you're going to be spending triple that in the long run. We need to think about things like vision and dental care as part of the whole health package and rethink how we pay for a lot of these services.
Gotcha. Carly Weeks, health reporter for the Globe and Mail. It's great to have you on TVO again. Hang in there, okay?
You too. Thanks, Steve.
Once upon a time, it really didn't matter that a small group of people subscribed to some quite out there ideas. However, nowadays, most of us have probably encountered such people who reject the consensus of experts or scientists in favor of conspiracy theories. Lee McIntyre is a research fellow at the Center for Philosophy and History of Science at Boston University, and his new book offers some help. It's called How to Talk to a Science Denier: Conversations with Flat Earthers, Climate Deniers, and Others Who Defy Reason. And Lee McIntyre joins us now from Boston, Massachusetts. Good to have you on the program again, Lee. How you doing?
Okay, thank you so much for having me back.
Not at all. Let's start with this. How many science deniers' minds do you think you've been able to change over the years?
I'm not sure. The problem is this. It's very hard to change someone's mind on the spot. You can't think of this as a kind of a hit and run. The goal in talking to a science denier is first to build trust. And then once you think you've got something along those lines, then you can ask questions, begin to work in facts. And so maybe you won't even hear about it until later. So I'm hoping that it's a little bit like Johnny Appleseed, that I've changed more minds than I know.
Well, let's pick up on the subtitle of the book and talk about the flat earthers, because you did go to a convention for people who genuinely believe that the earth is flat, and then you sat down and had dinner with a speaker and tried to figure out what would change his mind. What happened next?
I was lucky that he was open to the idea that that was an important question, because the flat earthers tend to say that their view is not based on faith, it's based on evidence. And so then the next question that I wanted to ask them is, okay, so if you're trying to reason like a scientist, you should know what evidence could possibly change your mind. And so he was open to that. The next thing that happened is I said, okay, so, start telling me what you think might change your mind. And his first response was if he went up in a rocket and he could see the curved Earth from space. But then he took that back because he said, no, maybe the window in the rocket would be curved. At this point, I made a proposition, which was, how about if we fly over Antarctica? Because according to the Flat Earth International Conference folks, Antarctica is not a continent, it's a mountain range spread out around the perimeter of the Earth, which, by the way, would make it 24,000 miles long rather than, 1,000 or 1,500 miles. And he shook my hand on this because at first he said, well, those flights don't exist. And I said, well, yes, they do. And I pulled the itinerary out of my pocket because I was ready for him. And then he shook my hand, said we could go. But then I started to worry that we needed a criteria because I didn't want him to say just, the window was curved. So I said, how about if we stop for fuel? If we have to stop for fuel, then you're right. But if we don't have to stop for fuel, then I'm right because, the difference between 1,000 miles, 24,000 miles. Shook my hand again, but then he took it back. And that was when the conversation got very interesting because he said that he thought that maybe the entire history of air travel was a hoax, that planes never actually needed to stop to refuel. And that's about the biggest conspiracy theory that you could ever imagine.
I mean, this is, you've really put your finger on the difficulty here, which is you can make one step forward of progress, but inevitably you're going to find yourself taking 2 steps backwards after that as well. How frustrating at the end of the day was that conversation for you?
Well, it was frustrating, but I made a smart decision, which is that I didn't just say, okay, well then, and get up to leave. I continued the conversation because it's, as I said, it's really about changing people's mind over time. And if you hurt the relationship, if you yell or you insult the person, then the relationship is really over and they're not listening anymore. What I wanted to do was just leave that idea linger with him, that he had said to me at the beginning that there was something that could change his mind, but that both of the things we talked about, ultimately he took back. Now, I could have been smarmy and said to him, well, I guess your view is based on faith then. But I didn't want to do that. I just wanted to continue the conversation because I was playing the long game. Maybe over time he would begin to sit with that and it would bother him.
One of the things I gather you discovered about some of the people at the Flat Earth Convention is that at some point in their backgrounds, they have experienced rather profound trauma. Why was that a significant revelation to you?
Yeah, I never expected this. This was a complete shock to me, and it was only about the third or fourth person that I spoke with that I started to think, is there a pattern here? A number of them had mentioned to me, I wanted to ask them, how did you get into flat Earth? What was your genesis story, if you will? And a number of them said that it was when they had this major breach of distrust in their life because something had gone wrong. Either it was an illness where they didn't trust their doctors, or a personal crisis where they were divorced or something, or broke off a relationship. For some of them, it was 9/11, where they reported that they just got skeptical that 9/11 could have been anything other than an inside job. It was too big, and that broke their trust. So for all of them, it was that their trust was broken. But the really intriguing part for me was how their trust got broken. And it was, for most of them, it was a question of trauma.
Here's an excerpt from the book. As I sat there, you write, I concluded that perhaps flat Earth wasn't so much a belief that someone would accept or reject on the basis of experimental evidence, but instead an identity. It could give purpose to your life. It created instant community, bound together by common persecution. And perhaps it could explain some of the trauma and other difficulties you might have experienced in life as the elites in power were all corrupt and plotting against you. That feels, Lee, like a real breakthrough. Do you recall that eureka moment?
I do, because it was the moment that I realized why facts weren't getting through. And it's because it's not about facts, it's about identity. You really, Jonathan Swift said it best, you can't reason somebody out of something they didn't reason themselves into in the first place. So why are we out there talking to science deniers, just trying to bury them in facts? That's not going to work. It's really, it's about identity, and which means that you have to build up some sort of a human connection if you have any hope of converting them. And by the way, there are plenty of anecdotal accounts in the literature which show that this does actually work, that if you speak to somebody with an extremist belief about science or about other things, and you are a human being about it, and you show some empathy and calm and patience and respect, that can work. It doesn't always work, but it can work.
How difficult is it to create that kind of connection? And knowing, as I'm sure you do all the time you're trying to create that connection, that you think the person that you're dealing with is, how do I say this delicately? Missing a few screws along the way.
Here's the interesting part. In a face-to-face conversation, it's a rare person who wants to break the connection. So as I was trying to build up their trust in me, there's a sense in which they were trying to do the same thing, right? So I had to put out of my mind the idea of why they believed it and just talk to them about their logic, about the way that they were reasoning about evidence. Later, I came to another kind of an important conclusion, which was that most science deniers are in fact victims. They believe what they believe on the basis of disinformation that's provided to them by somebody else on purpose. And it was the day that I realized that science denial was not an accident, it was a lie. And that was another important breakthrough. So that made it a little bit easier to talk to folks, because I realized that they really weren't getting anything out of this, and that in some sense they were sort of miserable.
When the notion of trauma, of something in their past, when you might put that to somebody who was involved in some of these crazier theories, did anybody have a eureka moment in their lives saying, oh my goodness, maybe this is why I believe as I believe?
I didn't say that. To say to somebody, the reason you believe this is, and then fill in the blank with, whatever psychology you want, they're going to resist that. Mark Twain said it's easier to fool somebody than to convince them that they've been fooled. And so my job was not to try to say, this is because of your identity or your ideology. It was to talk about, well, tell me why you believe what you believe. Why do you believe this thing but not the other? Why do you trust this person but not that person? So I was doing something that has since come to be called technique rebuttal. I was recognizing that there's a blueprint to science denial reasoning, and I was trying to unpack that blueprint to see if I could get them to understand the contradictions. Another important moment in these conversations is to realize, as I said in the passage that you read, that in some sense this is about community. If you distrust, the elites, the scientists, the government officials, the teachers, the astronauts, and you trust other people, you're going to be cut off from some pretty important facts. And so I was trying to enlarge the circle of folks that they trusted. Now, the odds were really against me here because there were 650 flat earthers, and here I was, a stranger who didn't believe what they believed. But I took seriously the idea that if you could talk to people with respect, you could build trust and maybe get them to listen. And that was really my goal. It wasn't necessarily to change their mind, though that would have been great. It was to see if we could have a civil conversation, and we could.
Well, let's move on then from flat Earth to COVID-19 and the international pandemic. And we're going to put up a bit of a checklist here, which you have discovered are, essentially the same kinds of things that you run into when you run into people who want to essentially deny the accuracy of the science as it relates to this pandemic. For example, there's a cherry picking of information that takes place, or a reliance on conspiracy theories, or a use of fake experts, or illogical reasoning, or a reliance on impossible standards for scientific reasoning. And as you look at this checklist, Lee, how are the things on this checklist playing out as it relates to the pandemic and COVID-19?
Every one of the 5 has been checked. And in the book, I go through for every instance, anti-vax, COVID, GMO denial, evolution denial, all of it. I go through and I check off all those 5 boxes. That rubric is something that other researchers discovered, some cognitive scientists before me. And that's really the blueprint for science denial reasoning. There are examples of this, of course, with COVID-19 denial or mask denial, vaccine denial, however you want to think of it. When you hear people saying that Fauci is lying, that he's in cahoots with the CDC, or that he's making money on it, well, that's a conspiracy theory. Or when people will talk about somebody that they know who seemed to get sick after they'd had the COVID vaccine. That's cherry picking. And even then, you could say that's also reliance on fake experts, because for all the claims that people are dying as a result of the vaccine, there was a fact-checking organization the other day quoted in Politico called the Poynter Institute, which found that there were 0 cases that had credible evidence of people dying as a result of the COVID vaccine.
Now, with COVID vaccines, people want to see with anything, they want to see the evidence. And with COVID-19, it's particularly difficult to actually see the evidence. And of course, the long-term consequences beyond that are going to be difficult to see in this very moment. In which case, how do you try to convince people to trust evidence, particularly if they can't see it themselves?
That's a really important question, because you've gone to the heart of the idea here that science denial is not about doubt, it's about distrust. And so the folks who are saying, well, this hasn't been proven in any long-term study, that's true. Scientists recognize that. But here's the thing that you have to realize. You have to compare the relative risk. So what's the risk that there might be something that would come down the road, a year or 2 from now, from the COVID vaccine, given an understanding of how vaccines work and their past history, not just this particular one. But also thinking about what is the likelihood that somebody who's unvaccinated might get COVID and face serious illness or even death. So there's such a thing as relative risk. Now, it is sometimes hard to get people to take that seriously. I had a back and forth with an anti-vax person by email that I was trying to, he claimed that there were 10,000 people that had died as a result of taking the COVID vaccine, which is just wrong. I mean, that number is just made up. And I asked him what his source was, and he told me it was an unreliable source. And then I said, look, even if you're correct, even if that outrageous number were true, it still might be a good idea to get the COVID vaccine, because look at how many people have died of this, around the world. And he came back memorably with the claim that, well, that was ridiculous because no one had died of the COVID had died of COVID anywhere in the world.
He thought nobody had died of COVID anywhere in the world.
In the world.
How do you have a conversation with somebody who believes that?
At that point, the conversation was over. I mean, there are some folks who are so far gone that there's really nothing that you can do. And I encourage people to understand that science denial exists on a spectrum. And the techniques that I'm talking about in the book can work on hardcore science deniers. There are case studies to show that they have worked, but they work best on people who are hearing scientific disinformation for the first time. So, get out there and speak to people who are the audience for science denial, the people who are confused, vaccine hesitant, if you want to think of it that way, before they go too far down that rabbit hole. Because here's the thing, if they begin to distrust for too long and they find community amongst the hardcore deniers, then they're going farther and farther down that rabbit hole, and it's harder and harder to reach them.
In your experience, is it possible to get somebody who's that deep down the rabbit hole to get them back into the land of the living and the thinking?
So in my personal experience, I've never succeeded in doing that. But again, there are anecdotal accounts that I've read in the literature. One of my favorite, this is about climate change, but it's maybe one that, that folks can verify the details on fairly easily. Jim Bridenstine is a member of the U.S. Congress, or he was, and he was a climate denier. And he gave a speech in the House floor saying all the things that people say when they don't think that global warming is real or that it's caused by humans. So, of course, what do you do with somebody like that? President Trump, at the time, appointed him to be the head of NASA. Well, Bridenstine was in that new job for about a month or two, and he completely changed his mind. He gave another speech in which he said, I was wrong, climate change is real, and it's caused by humans. Now, why did he do that? I think it's because he began to trust the scientists at NASA. These were not the faceless, evil people in on the conspiracy anymore. These were the folks that he saw every day in the hallway, or he had lunch with them. He was their boss. And he learned that scientists are pretty warm and trustworthy people. And I think that's what changed his mind. And I discuss many cases in the book of anti-vaxxers who have changed their mind.
All right. Having said that, though, do you ever have those moments where you have second thoughts about your chosen field of study, given that we live in a time that it is, well, let's put it this way. This appears to be a particularly fact-free time in North American history. And do you ever sit there and wonder to yourself whether or not you are just banging your head on the wall far too much?
I sort of do, but what's my choice, right? Go hide out in the bunker? I mean, remember, I'm a philosopher, and for the first time that I can remember in my career, people on the news are talking about facts, truth, and evidence. It's my time to step up and to do something about this. This is why I got interested in this topic in the first place, in defending science and, thinking about how people got toxic beliefs and how to get out of them. So I'm really out there right now trying to recruit more people to take this problem seriously, because here's the problem. If we don't take this problem seriously, it's only going to get worse. I don't see science denial going away. And worse than that, I think that it is causing reality denial, what some people have called post-truth. In the United States, we have people who are now members of QAnon or denying that the 2020 election was legitimate, or who think that the January 6th insurrectionists were just peaceful protesters, or worse, that they weren't even protesters, that they were members of Antifa in disguise. This is all part of reality denial. And if we don't fight back against denial, I think that we're in big trouble.
And in our last 30 seconds here, Lee, what will constitute success for your mission?
My mission is to write this book and publicize it and get more people convinced that they actually can have a role. You don't have to just walk away. There was an empirical study in the summer of 2019 which showed that technique rebuttal works, statistically significant result against science deniers, and we all have a role to play, not just the scientists, all of us, in talking to people who already trust and love us. Maybe pick out that cousin or uncle and have a calm, respectful conversation. You just might change their mind.
That sounds like great advice, and we are happy to have played our part tonight in giving you some airtime on TVO to discuss it. How to Talk to a Science Denier has brought Lee McIntyre to our airwaves tonight from Boston, Massachusetts. Lee, as always, great to have you on the agenda.
I really enjoyed it. Thanks for having me back.
And that is the agenda for Tuesday, September 28th, 2021. 49 years since Foster Hewitt spoke those immortal words, Henderson has scored for Canada. And I'm putting our executive producer, Stacey Dunseith, on notice right now. Next year, for the 50th anniversary of the Super Summit between the Soviets and Team Canada, we got to do the whole show on it. I'm letting you know right now. Okay, meantime, now that the vaccine passports are required in Ontario, those still without a COVID-19 inoculation face a really new world, and we'll look at their experience tomorrow. I'm Steve Paikin. Thanks for watching TVO, for joining us online at tvo.org, and we'll see you again tomorrow.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism. Looking for more of TVO's in-depth current affairs and documentaries? Visit tvo.org/daily and sign up for our daily newsletter with links to agenda interviews, read Steve Paikin's articles, and preview our upcoming documentaries. That's all at tvo.org/daily.